thing on the agenda is to approve the minutes of last month's meeting. Someone like to make that motion? Supervisor McDevitt, seconded by Supervisor Driscoll. Any additions or corrections? All those in favor?
Aye.
Opposed? Carried. Chris, how are you this morning?
Good, thank you.
Good, thank
How are you after your long vacation, Chairwoman?
I'm fine. A little too long, but it was good, thank you.
Glad you enjoyed it, Madam Chair.
I did, thank you.
The first thing that we have is a personnel request to create and fill the position of Principal Social Welfare Examiner number 3 in the Temporary Assistant Unit. This is a grade 15. Base salary is $42,141. Sorry about that.
Not sitting down at my seat, I don't get my packet.
We are deleting the position of Senior Social Welfare Examiner in order to put that into our TA unit. This position will work primarily with SNAP and HEAP programs within eligibility. We have put this in our budget for 2020 as well.
All right, someone like to make that motion to approve that? Supervisor McGowan, seconded by Supervisor Sokol. Any questions? Yes.
So may I ask what the difference between a senior and a principal is?
The principal is over a larger group of people, including a couple of seniors under them. We found that one of the things that principals do is they approve work within the workflow. So when people are working on cases, there are certain aspects of the work that needs to be approved or needs to be reviewed. Sometimes they need to meet on cases. The principal is basically one step above the senior, and we have found that there's more of a need for a principal in this area over specifically SNAP and HEAP, because that's an area that's been increasing as far as the work. HEAP has been turned into a year-round program now as well. So one of the things that we thought we would do is not fill this senior social welfare position and delete that and add this position of Principal Social Welfare Examiner, so that we can have a little bit better oversight management and also have another level to approve certain work that needs to be approved.
Mr. Moore, did I see your hand?
Yes, if I could put it into context with the rest of the budget, this deletion and creation was part of a larger package of personnel requests, which the budget director, the budget officer rather, has approved. Those changes in total save the county money. It's an overall deletion out of the budget rather than adding additional funding. And it does allow DSS to get a staff development coordinator. I think just about every other social services district in the state has a staff development coordinator. The reason is there's so much training for these individuals. The jobs are also really hard. So it's the right thing to do for the department to add that position. It's all part of this package. I think this one's coming to you today because the department wants to get a jump on the recruitment.
Thank you. Any other questions, Ms. Bramer?
That was my thought, is it seems a little premature since we haven't approved the budget and it's not effective until January. Can we hold off a month, or do you think you need that time to get the recruitment done?
We are not planning on filling this until after January 1st. If for some reason it didn't get approved, obviously we wouldn't fill the position. So we did have an effective date of January 1st, 2020 on this one. The position is also a reimbursable position, so as Mr. Moore was saying, it's not going to be, it'll actually end up being a cost savings in the end.
All right, and let's take a vote on that. All those in favor?
Aye.
Opposed? Carried. Thank you.
The second one we have is an anticipated vacancy. It's a request to fill a position of senior account clerk in our accounting unit. It's a grade 7. Base salary is $33,600. The effective date is not yet determined. We are going to anticipate filling it at some point after November 15th, 2019. It's an essential position in the accounting unit that's actually been open for quite some time. So we're hoping to fill that.
All right, someone want to bring that motion to the floor? Supervisor Sokol, seconded by Supervisor McGowan. Any questions? All right, any questions? You're all good, Mr. Leggett?
Yeah.
Okay, Ms. Bramer?
Sorry, why are you calling it an anticipated vacancy then if it's been open for some? Guess
Well-
it's not really.
It's a person that's been out for a medical leave over a year, so we're anticipating at this point that they probably won't be returning.
Gotcha.
So with that said, we're anticipating to fill that
Yeah,
position
okay.
at some point.
All right, any other questions? Supervisor McGowan?
You say you haven't had one for a year?
Yeah, that's correct. This position's been, I mean, we've been kind of struggling and filling the gap in, but it's been a little over a year now, right?
Yeah.
Yeah. It's one of the, yeah, and we're not allowed to fill the position. The reason why we're bringing it now is because we're not allowed to do that because of the circumstance. There's a certain point in time when, due to civil service regulation, we are allowed to fill the position based on how it's resolved.
Go ahead, you have another question.
Yeah, I'm not questioning, the filling of that, but like I said, you know, we all struggle with things sometimes and really trying to see where we can save money in that. I mean, is it that much of a struggle that, you know, you need to fill it, or, and it's just a question, I'm not...
I had come to committee back when the position became, which went out medically, to get somebody. I did find somebody to work part-time, but it was very limited. She could only do it for, I think, about 4 months. It has been extremely hard. We're only in office of 5 people, so when you take one person away, it creates a lot of stress on the staff, a lot more work. You know, I'm coming in early, I'm staying late. I took up a lot of the work, and I just, with this additional work, I feel like I'm not giving the time to my own job duties because I'm stretched so thin. And my staff feel the same way, because we've all had to take on some of this work.
All right, thank you, and like I said, it was just a question, nothing to say, I just want to see where we maybe be able to trim here and there. You do have a very large budget, but thank you.
Supervisor Driscoll?
Thank you, Madam Chairman. Just a point, social services isn't the only department during the course of the year that, I guess, struggles with the laws with civil service. And all departments, at one time or another, large with big budgets or small with smaller budgets, have to be creative and pinch hit and help out, but in the course of the daily activities, there's going to be some bumps incurred when you do that. So in the long run, it's really more efficient and effective to fill those slots as soon as you can. So.
Yeah. The other thing is that this is a position that is really, it's key because in our accounting unit we have a lot of funding streams that we need to access for various programs and to get reimbursement. If we take people away from those areas, there's something that could be missed. There's a lot of things that need, a lot of detail work. And workers in that unit really need to be 100% to make sure that we're getting all the reimbursement for the programs that we run, including for reimbursement for salaries. So if people are taken away from other areas within our fiscal unit, it becomes stressful. We've had a couple situations which we talked about the last time that we were here in regards to claiming. There was an issue with the state with claiming, and that creates another issue if you don't have the staff to keep on top of those things. Fortunately, Julie is very competent and has stepped up and held that together, and I thank everyone here for approving that part-time position, temporary position that we did have earlier in the year. So thank you for that as well.
Okay, well, thank you for explaining that. We do appreciate all that extra that you put in for us, Julie. All right, let's vote on that one then. All those in favor?
Aye.
Opposed? Carried. Thank you.
The last item that I have is request permission to accept a donation in the amount of $5,000 from the Warren County Children's Committee. Tammy Breen has been working with them in the foster care unit and preventive unit in order to get this grant from them to hire a person who will do evaluations for children and families. It's an area that we really needed help in. We've had a couple people retire. We've had a person who was working with us from the state who got relocated to another area, so we couldn't use him anymore to do this stuff. So we have entered into an agreement with Tracy Phillips Perkins to do some work for us with children. This is generally stuff that might be generated through the family court, so if a judge says you need to get this evaluation done, or if we feel it's something that's necessary to help a case, we'll have this woman be able to write these reports that we're having a hard time getting right now. So we're asking to accept that donation and put it into our budget to pay this woman.
All right, thank you. Someone like to make that motion? Supervisor McGowan, seconded by Supervisor Sokol. Any discussion? All those in favor?
Aye.
Aye. Opposed? Carried. Thank you.
Revenue and expenditures for September, we're pretty much on target for the 9 months of the year. Our claiming issues have been fixed, I think just mentioned that, and the state's not anticipating any delays in our settlement. So our revenue came in pretty strong for September, and I am anticipating through year end as well. For our overtime, we're always trying to keep it as low as possible based on our CPS calls and training that we have no control over.
Supervisor Loeb.
Thank you, Madam Chair. This question after all these years just came to mind. If we didn't have a budget surplus to cover our payroll, would the delay in revenues coming in impact our payroll, being able to pay payroll? For the ones that are covered by state or federal funding?
The payroll portion of the budget is really based on actual, so I don't think that's an area that would be hurt as much as like our contractual areas. Because we're getting a lot of reimbursement in those areas. I think that might be more effective than our payroll because when those salary schedules come out, they're pretty spot on. They have each individual employee, it has their benefits, so going into January 1, we know, when there's a contract, we know exactly what everybody's going to be paid. And throughout the year, you have to set the for a little while. So generally in our wage area, we usually have surplus rather than the other way around.
So, just to clarify so in any of our expenses that are reimbursed, none of them, any delay, routine delay in the reimbursement is a negative impact on our cash flow.
No, I mean, we do the projected cash flows every month. If I'm foreseeing low cash flows for a particular month or two, such as when our claim system was down, the first thing I did was report to the treasurer's office that there could be a problem and that I would report that on my cash flow. So they're anticipating what's happening on a monthly basis as well in the treasurer's office. I think what happens when the budget goes in, they put that budgeted amount of money so that they cover all those costs that are in the budget. So hopefully the revenue will match as well, but the budgeted amount is there to pay out.
Okay, if just go back 8 years, we only had $3 million surplus. So every month we had to borrow money, short-term borrowing, to cover payroll and all our expenses. So that's where would the delay in reimbursement have to be then covered by borrowing money? If we were like we were in 2010. That's,
I would say no.
thank you.
Supervisor Conover, I thought I saw you.
No, I didn't, Supervisor Lova, I didn't answer the question.
Okay. Any committee member have any questions? Yes, Supervisor Leggett.
So, Julie, the $3 million difference between this year and last year on revenues, that's just on timing then? You figure it's going to...
Unfortunately, when we do a claim, we get paid 3 months later on that claim. So what happens is our October, November, December is technically paid in January, February, and March. And we have to do an estimated accounts receivable. And then it will get applied to the correct year. But you don't see it until it comes in the following year. There's nothing easy with social services. I wish it were all black and white, but it's not. That's why we do work very closely with the treasurer's office. Rob is just, really he's a great resource and right on top of how things work in social services. And I think between our cash flows and that do go over every month, she's staying right on top of what's going on over in social services.
Thank you. Anyone else? Supervisor McDevitt?
Just a quick question, maybe Chris, the 102919 Taste of the North Country foster care recruitment, just tell me about that.
Yeah, thank you for asking about that, Supervisor McDevitt. We had a booth set up this year, and we've decided that we're going to start going, try to do some recruitment, a little bit outside the box, not just advertising, but be more present in the community as well. So this year we set up a booth. We had a foster parent there who was helping us, and we had the supervisor of foster care, Maureen Taylor, and supervisor of children's services, Tammy Breen, there as well. So it was good. And Tammy brought her 2 daughters to do face painting because they require you to do an activity if you're going to be there. So her daughters, who I think are 16 years old, were face painting children. So if you saw children running around with their face painted, came from foster care.
Oh, neat.
I think it's a good idea.
Supervisor Driscoll?
Thank you, Madam Chairman. I just wanted to commend you for the activity and update report. I think some of the training has both a quantitative and qualitative impact on the department, and I encourage you to continue providing those opportunities for staff, and also, like you said, getting out into the community and collaborating with other not-for-profits and area organizations that assist people. I think it contributes to the process that you're doing your daily work. So, thank you.
Thank you.
We do appreciate that update report. Gives us a little idea of what's happening over there, so that's great.
I keep it brief with the bigger things. I don't put every little thing in there.
No, that's good. Anyone else on the committee have any other questions? Anyone in the audience have a question? If not, then I guess we'll... Nope, we don't. We'll move on to, public health. Thank you.
Thank you.
Guess what?
Not that I want to tell you what's up next.
Well, that's okay. I'm glad you did. I don't take
It's been a really good
offense at
vacation. You're relaxed.
Yeah, right. Not really. Remember, I've got an election to go through.
You look like you committee your science.
Public health in here.
They're probably out
You
there.
are opposed, I don't see any of the others.
I figured that's pretty good.
You wouldn't even think there was an election.
You should have made me a...
You look at the whole city, there's less signs than I would put out in the 4th Ward.
Right, it's amazing. I put out any kind of test we have.
Yeah.
I just hope that is
It's a learning curve.
Are you having an opposition? Are you kidding me? 9 opponents.
No, that's Gary.
John?
Just,
I
Katie.
think I'm gonna stop running my...
I heard it was
Oh, my
exciting.
God.
She had to go to Albany Med today.
Oh, they had 48 of them, but, yeah. Nothing, and then they came back one ready to do, so, yeah.
No, we'll go
I talked to, Gordon.
How are you?
Right, yeah.
Right, actually, pocket dialed him, he said he was at the game.
All right,
I didn't buy any.
She got there, she immediately...
Candy for breakfast again?
His dad is still on by
Candy for breakfast again?
His dad is also
Oh,
really? Yeah.
You should...
Morning, ladies, I think we're all set.
Hide that from us.
Nice to see you all.
I didn't buy any new ones.
My dentist loves me.
Good.
All right, our first and only resolution request is to award an RFP WC 71-19 and authorize an agreement with a vendor for the best value proposal to provide medical coding, education, and review services for our home care agency with the option to renew ×4 annually as long as the rates do not exceed 50%, with termination upon not to exceed 5%, with termination to be within 60 days written notice by either party. The revenues depend on accurate recoding for our home care agency and documentation. Coding, education, and review services are needed to ensure compliance and to decrease billing process time. The vendor selection is anticipated to be prior to the November Board of Supervisors meeting. If you remember, we approved this at our September meeting and we pulled it before the October meeting. The reason being because of the amount of money, even though to get us through the end of the year it wouldn't hit that threshold, but on an annual anticipated amount, it's really an RFP process, not something that we could approve through our committee the way that we tried the first time. So we're kind of back asking for the same thing, just in a different way. As far as the RFP, it was sent out. We're looking at criteria that supports our strategic plan of trying to optimize reimbursement. We're looking at 24/7 availability by the vendor. We're looking at the services for medical coding, education, and chart review. They have really cool programs now where they're able to assess each clinician and determine what the weaknesses are and then provide spot-on education to help compensate and train for that so that it's not reoccurring. We're looking at turnaround time, just to streamline that billing process. We're looking for it to kind of be within 2 days versus a week or something like that. And then we're looking at compensation of a fee per use. So we're only paying for the charts that we submit out. We're not doing 100%.
Okay, sounds like you could get a lot of information there from that. All right, someone like to make that motion? Supervisor McGowan, second to that. Supervisor Loeb, any questions? All right, all those, hold on.
Thank you. So, does this come in onto your home health as well? And
It is our home health.
so, how are they doing with all their software and stuff? Has that been ironed out?
Things have settled down a little bit. We've spoken with the vendor. We're now into our electronic medical record. We've spoken with our vendor. They've been attentive to our needs. We have like a hotline kind of person that we can talk to if we feel like issues aren't being resolved, so we're getting that done a lot quicker. There's some things that just can't change because of the way the vendor's set up and the record's set up and the fact that they're working for other agencies as well. If you tweak this, it tweaks for everybody, and if it's something that's of the common good, that's great, but if it's just our agency specific, might not be good for the whole thing. This vendor that we're looking at to help review our records is going to be compatible with Crescendo and able to review our records in Crescendo, and part of this process is us also looking at references. There's 3 main vendors that we've already talked to when we went through the process the first time that we got references on, and we worked to compare to see kind of who we thought might be the better vendor, and now they're all included in this RFP process, so we'll go again, so they should be over scrutinized for that.
Thank you.
All right, good. Any other questions? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
And we'll let Ton deal with attachments 1 and 2 for our expenses, revenues, and the comparison report.
Okay.
Attachment 1 was our financials as of 10/10 when we prepared this. We had closed the month of August, and I did accrue that in our revenues, I've noted that. And regarding our salaries, below you'll see that overall we've kind of, because it's getting towards the end of the year, we've caught up a little bit where we're dollar to dollar when it comes to regular salaries, and our overtime salaries, a little bit over still compared to last year. Part-time salaries, though, were way down. We had noted that we had a per diem person who was doing coding for us, retired at the end of July, and we just recently had another per diem nurse that has met her max that she can work as a retired nurse who came back. They can only do so much within the year, so she's now gone. So our part-time salaries definitely will not meet what was budgeted because of those issues, so we're going to be below there. But overall, if you look at this point, we're 64.4% of the budget at this time, where last year at this time we were 75%. So we're still under overall compared to the budgeted totals. Attachment number 2, again, is a comparison last year at this time to this year. Just to give you an idea, again, the salaries, which we talked about. Equipment, not really much to talk there. Contractual, again, we're a little under, and when I looked at it, it is a lot of it is to do with both our preschool and our home care programs. Again, I think it's just timing of invoices. When I compare to where we were last year to where we were this year, that's where the difference is. So it's just getting those invoices finalized and in, and again, it's just a timing thing. Employee benefits, again, a little below, again, because we have some shortages or some positions not completed. And revenues, yes, we're down. One of them is the reason, and when you were talking about the crescendo, one thing I just will note that because, as you've heard us say, nurses have said they've lost notes and whatever, one of the things that IT did was purchase, I don't even, it's an IT technical thing, but some kind of a box, then they had to hardwire into all of our nurses' stations so they can click into something, so therefore things should be saved better. So they all have that now, and that did delay because we found when that happened, it was the end of August. All of a sudden in September, we realized things hadn't come over, and we're like, it's because the new system was talking to the old system and just a password, whatever. Figured it out, manually able to do it, our billing person, Tara, was. So that all kind of happened in September. So we'll see that. That's already been billed out in September. So August was a little low because of that, but September has been caught up, and now they're working on closing September. So other than that, status quo, I guess we could say.
Any questions on that? Supervisor Loeb?
Thank you, Madam Chair. So this is the question actually I asked social services. In your revenues, is there a significant amount of revenue that comes from the state and federal government as regions?
Not so much on the home care side, but on the public health side. So we have state aid and we have grants.
And that's not immediately or instantaneously reimbursed. So if you were just relying on the reimbursements, would you be able to cover your expenses, or would there be a delay in covering your expenses?
Never with the public health side, because first of all, our preschool, I believe it's at 59.5 cents on the dollar we get back. On the early intervention, it's 49%. That's state mandated. That's what we get. Regarding our grants, usually they're quarterly, and I usually get payment within, I'm going to say less than 2 months from our grants. By the time I have to bill them, and usually we see payment on those. Again, they're not big. Our state aid, the same thing. By the time we bill it, we usually get that. Our preschool program is one of those, they've set the dates when things can go in. Same with billing of Medicaid for the preschool program, and when the date is that it's come due. And that's why usually our revenues, I always say, look like they're going to be behind, but we don't get a notice till like February or March of the following year when we can bill the end of 2019. So those will be back and put in. I mean, they never close the books for the county, and so we get those numbers. So there's always that delay, but I can tell you it's never 100% because our EI and preschool programs are mandated.
And one thing about the grants is you have to spend the money first, and then you have to submit those vouchers for payment. So they pay you back what you spend, but you're not going to have the cash flow ahead of time.
I guess that's like the DPW building roads too, same sort of thing. Thank you.
All right, thank you. Thank you, Tom. It's Supervisor Conover.
Three quick questions. Right now, the plan called for revenues to be less than expenses by about 60.2%. But I guess at that time, I think the thinking was that the expenses might not be quite what was budgeted. On the revenue side, do you see revenues exceeding 18 or on par with 18? They're on par with 18. Expenses are on par with what's budgeted. Then
Right.
I guess a general question for you is, where do you see we're at right at this point in time? Do you think it'll be a little more than what was budgeted?
I'm hoping not, because our goal is always what our bottom line impact is what we hope to get. Last year, we came way under with our home care and stuff, and we've also been very lucky in the fact that we've gotten these district funds, which have helped offset, and also the CARE grant, which has helped offset, which is new to this year, which we didn't have last year. That's the grant that we work with DSS on, and that's been very helpful. So those kind of things that we didn't have last year that we have this year, and hopefully will help offset those expenses if we have any. Again, we do have nursing positions that are still available, and like I said, and then we've had some per diem who now we're down to, I think, 2 per diem in the home care that has left, and 1 nurse that's out on right now on medical leave. Those are things that, that salary's not going out, obviously, so it's helping us save in that respect, but I'm thinking we're still on our goal target. When I look at the whole picture of our agency, not specifically to each one, but when I look at the whole picture, hopefully that bottom line impact will still be the same, if not less.
I won't hold you to that.
I don't know. Can't guarantee that.
That's just your crystal ball.
But we're in October now, so we're getting closer.
All right, the third attachment is our status of referrals. If you remember last month, we updated it to include our visits. We're 59 down from...
All right.
So looking at the total visits from July and August, it is down 59, but we're not concerned because that could be secondary to the diagnosis. Different diagnoses require more visits. We're also looking to go towards the patient-driven goal management system, where we're trying to manage the patient with fewer visits as well, without compromising patient care. So not concerned there, but, questions.
Okay.
The fourth attachment is our emergency preparedness activities. Just worth noting, we have a drill coming up on the 24th of October. It's to test our staging site, which would be if we received assets from the state, had to go take them. We're working with our friends at Department of Public Works. We're going to be breaking those packages down and then redelivering them to a site, setting up to show that we can do that. So working out any kinks ahead of time. Other departments have always been phenomenal and wonderful working with us with a collaboration, and right now we're working with Buildings and Grounds and Department of Public Works. The next 2 attachments, you've got 2 for attachment 5. One's a quarterly report, one's a monthly report for rabies. If there's any questions, you can let us know. Informational item, attachment number 7, we've started our flu clinics. Right now we've received 44% of our shipment. We're trying to get our clinics done. We might have to postpone some. We're expecting all of our shipment, but everybody's kind of seeing a delay this year. But, so if you hear anything or any concern, just let us know.
Sure.
Yes.
Well, I had my flu shot.
Very good.
I don't know what I was expecting, but there was a pretty good needle on those shots.
All wrong.
For some people there
I
are.
worried that the nurse knew who I was.
Could have been.
Which I thought it was overdone, and I didn't even know it.
And hopefully you'll have a happy,
But it's a
healthy
great
season.
outreach that you do, and hopefully you'll get all your vaccines. Are there any issues associated with that? Did you? Good.
No, it's just a delay in their shipment. As far as staffing, as Tom mentioned, we're down our 1 nurse who's on extended leave. We still have our open 2 positions that we are recruiting for. And with that, I further business.
All right, saw someone's hand, Mr. Lowe.
Thank you, Madam Chair. I have a question. Every month we get the rabies report. and looking at the reportables you get from both hospitals, infectious diseases, STDs, that would include rabies, we've had some sort of diagnosis. Well, why do we get this report and not the other reports?
We're happy to give you whatever information you want. I think the reason behind the rabies was each town was trying to track what kind of bites they had because they had animal control officers that were helping with that. So that was one reason to kind of help show the volume that each town is getting in relation to what we're getting within the whole county overall.
Okay, all right, thank you.
Anyone else on the committee have any questions? Thank you, ladies. I'll entertain a motion to adjourn. Supervisor Driscoll, seconded by Supervisor Kramer. All those in favor? Aye.
Aye.
Opposed? Carried. Thank you.